Hi, I'm Dr. Catharine Goodson, founder of Medical Emergency Mastery. I teach dentists and their staff how to recognize and manage medical emergencies that occur in their practice so they can best protect their patients' health and safety. About 10 years ago, my patient experienced an asthma attack during routine dental treatment. She stated on her medical history that her asthma was well controlled with the use of an albuterol inhaler. When she first began to experience difficulty breathing, I assisted her by obtaining her rescue inhaler. It was evident in the next minute or so that this was not a normal asthma attack. This would not be controlled by the use of her rescue inhaler. She began to experience the high-pitched crowing and wheezing characterized by a severe asthma attack. In the ensuing 5 minutes, it became evident that this was a true severe emergency, and I knew that maintaining her airway was going to be of utmost importance. It did become necessary to phone for emergency assistance after the use of an epinephrine pen. What did I learn from this experience? I learned a lot of things. While at the hospital, I spoke to her family and talked to them about this asthma attack. They indicated that she had had many incidences like this in the past. When I asked them why she didn't indicate this in her medical history, their response was simple. She was afraid that I wouldn't treat her. Well, I probably wouldn't have, but I began to examine my part in this treatment, and I realized one very important thing. I didn't ask the right question. There wasn't a question on my medical history about hospitalizations for asthma. There wasn't a question on my medical history about hospitalizations for very many things. So I realized I had a problem with my medical history. I realized I had a problem with a lot of things on my medical history. Well, I realized a couple of things from that incident. I also realized that my emergency drug kit had far too many components that I wasn't qualified to use. My emergency drug kit was strewn all over the office. I had training in advanced cardiac life support, but my staff couldn't find the drugs that I needed. They looked, and they finally found an EpiPen, but when I looked at the aftermath, I realized that we needed some help in organization. The third thing was, I realized that we needed training in emergency response. I had worked with my staff for many years, and yet, in that emergency, they were unable to respond cohesively. So that became my mission in dentistry, that no one would have the problem that I had. And Medical Emergency Mastery was born. What I did was developed a medical history that was concise, that asked the pertinent questions to help the patients reveal the most about their medical history. I asked questions that help patients determine their dental readiness. My emergency drug kit has drugs that general dentists are qualified and able to use, labeled in a way that the staff can obtain those for us. They're labeled with medical and layman's terms, and they're labeled with the instructions for use. Our staff training is divided into 3 specific sections. Number 1, staff training in the recognition and management of medical emergencies. Number 2, specific designation for staff roles. And number 3, role playing for each staff member. We teach dentists and staff to develop their medical history to be one that will be reflective for their patient population. Number 2, we train staff to use the emergency drug content. And then number 3, we work with the staff together to videotape their progress, publish those to a YouTube channel, and allow the staff to review their cohesive action. This helps the staff to respond in unison during an actual crisis. That the average dentist will experience 8 to 10 medical emergencies throughout the course of their dental practice. That means that on average, there's 150,000 medical emergencies in dentistry each year. I would like to offer you a complimentary set of worksheets that will help you and your staff document your staff's emergency simulation practice, track your inventory of necessary emergency equipment and supplies, and the contents of a 911 emergency call. This information is essential for you to begin your preparation process. To receive these worksheets, simply enter your name and email in the box to the right, and they will be emailed to you promptly. I think you will find this information extremely helpful and will help you organize the information that you already are obtaining in your practice, but in a more concise, orderly fashion. Medical Emergency Mastery is committed to providing you with the most up-to-date, concise information. You'll find on our website many useful tools, information, and a blog that's committed to providing you ongoing continuing dental education. For information about bringing our Medical Mastery program to your office, please take a look at the different areas of our site. Our store offers a complete line of products that guide in the recognition, management, and treatment of the most commonly occurring medical emergencies. Thank you so much for taking the time to visit with us today. For more information, just drop me an email. Thank you so much for the commitment that you've taken to your staff to obtain the very best training. Have a great day.